So every possible AI is on now.
Great. Awesome.
Okay.
Okay, thanks, Lou. Thanks, Judith. So, yeah, we're going to start on time. Thank you so much, everybody that's joining. I'm sure a lot of people are actually going to watch the recording. Guys, welcome to this year's first Flaminglet webinar. I cannot believe we're only doing this in April. This year has just started and sped away with all of us. I am sure you are feeling it at the hospitals and in your clinical duties and academic duties as well. But thank you so much for joining us, for making time, and most importantly, for making time for yourselves. I think we are tackling a very important topic tonight, especially for you guys, by a very special guest lecturer. So I would like to introduce all of you to Judith Reynolds. So she is actually a lecturer in the Humanities Extended Curriculum Program at Rhodes University in the Eastern Cape. And she is currently working on a PhD looking at how academic and non-academic aspects of students' lives intersect and how they actually manage these intersections, which is, I think, so topical and so relevant to what you guys are navigating every single day. So Judith is also trying to find balance in her own life, not scared sharing that. She do yoga, she walks, she reads novels, and she loves traveling. And what makes this also extra special, and I think puts even more perspective on this, is that Judith herself was diagnosed with stage 3 breast cancer in 2016. So she speaks to us not only as an academic and somebody very knowledgeable and somebody that can maybe impart on you some very valuable skills, but also as somebody that is incredibly familiar with what our patients go through. So Judith, thank you so much for your time. Thank you for your energy and your expertise. I'm really looking forward to this conversation. Resilience. I think while we all are super aware that the world has never needed more resilient people, especially for us in medicine, it's a fine line between resilience and pushing yourself to absolute burnout. So I really look forward to your talk. So over to you.
Thank you. So just to say, I'm just kind of getting to know Project Flamingo. I went to one of the weekends, one of the catch-up surgery weekends in East London, end of last year. And this is the first time that I'm presenting to you. So I'm just learning about the organization. I'm just getting to know it. Yeah, so we'll start with you and your understanding of resilience. So, it's, you know, when you were told, or when you read that you were going to be going to a workshop or a webinar on building resilience, what understanding of resilience do you bring to this webinar? What do you think resilience is? Anyone can just unmute and offer something.
Guys, I'm just going to say again, safe space, so please speak up. These things are only valuable when we actually interact, so please share your thoughts. If anybody has any, it would be lovely. Yeah, I can kick it off just for saying that. So for me, resilience is that when I think about resilience, I immediately think about something that is asked. So when something is difficult, I can find it in myself to not only push through, but to remain centered and to remain steadfast, and to find that extra little bit when, you know, there's also the option of saying this is too hard. That's just my simple, you know, when I think about resilience. Anybody else? One of the students, is this a word that you hate?
I'm sure this is a word that you know.
Christina, or I don't know, Lorato, anybody? Does resilience resonate with you in a particular way? Is it a word that you hate hearing? Is it a word that just being
Yeah, you might hate it. Some people do hate it.
Hi, I'd like to contribute.
Thank you.
So what I understand about resilience, it's just basically the ability to bounce back, if I can put it like that. Being able to go through a challenging situation or to face a period of your life where you are basically going through something that is, challenging or demanding for you physically or emotionally and mentally, and also being able to come out of that challenge alive and and like more empowered than initially. It's just being able to go through something, come out of it, feeling, like you've learned something and you're empowered.
Okay. So you said a couple of things there. One is kind of bounce back, which suggests that you go back to what you were like before. But then later, as you spoke, you almost, well, no, you did suggest that perhaps you could come out of it stronger, perhaps even. Which, yeah, there are different ideas about what resilience is. So that's fine. We'll use that as our starting point. That idea that there has to be some kind of risk or challenge, right? So you were talking about a difficult time or facing a challenge, so for students that might be like dropping out or, having difficulty in a particular course or something like that. And obviously for people who've been diagnosed with cancer, the diagnosis would be a risk or a challenge. So I'm going to do this all through the webinar, is kind of try to get you to relate, or the students to relate to it in terms of your own lives, and then also kind of relate it to a cancer diagnosis or a cancer process. So yeah, to recognize resilience, there need to be these three things. There needs to be some kind of risk or challenge. If life is just hunky-dory and all going fine, then you don't need to be resilient, and you're not going to need to show resilience. And then there needs to be a positive or better than expected outcome. So, if someone is going through a really tough time with their degree, then even just graduating would be seen as a positive outcome. But ideally, you guys are gonna graduate or complete and have a reasonable degree of well-being too. If you just get the academic stuff done and you're broken as a person, that's not so great. And for a person who's been diagnosed with cancer, it might be getting through the cancer treatment with a reasonable level of physical and psychological well-being. So, I mean, a lot of people in cancer circles would talk about a new normal. There's not often, for people who've had quite a lot of cancer treatment or things that have affected them, you can't go back to what you were before, whether that's physically, whether that's energy levels, whether that's psychologically. But what people would be looking for is a new normal, which is different, maybe in some ways worse and in some ways better. We'll talk about that a little bit more. And then there need to be the resilience factors that lead to the positive outcome. So what is it that allows someone who has faced a challenge to still have a positive outcome? So what are the things that allow a person to get through the situation and manage it and whatever? So Lou mentioned kind of personal strength, or sort of qualities, but I'm going to try and shift us away from that idea a little bit and move away from a very common sense understanding resilience, because in a lot of kind of common sense, and even in some research, and certainly in the earlier research on resilience, there's a tendency to kind of make it about being a personality trait. So we'll just have a look at this quote. I am an academic, so you get quotes and references from me. So Zembalist refers to the psychologization of resilience and says that the political is pathologized, and rather than investing hope in political struggles to make life better, resilient subjects take it as their own individual responsibility to face up the dangers and adapt to the new realities. You know, if we think of things like levels of poverty or socioeconomic differences, it's quite clear that some people have more to cope with than others. So some people need to be more resilient than others, right? Because some people face more challenges. And that can result in resilience being an expectation foisted primarily on historically and contemporarily oppressed and excluded populations. So some people might have more to deal with because of their race, because of their socioeconomic class, because of their sexuality, and that can affect people in a whole range of ways. So unfortunately, the more disadvantaged you are by race, gender, socioeconomic circumstances, and so on, the more resilient you are required to be. So resilience rhetoric can entrench the status quo, like basically, you know, just suck it up, deal with it, and, you know, the resilient people will get through. So we need to be a bit careful about, not making resilience an expectation of people, you know, for people whose lives are really tough, because we need to acknowledge that some people have more than others. Some people are not more resilient because they have more resilient personalities, but because they have greater access to resources. Anyone want to comment or ask anything about that? No? Okay. So the way I understand resilience in my PhD and in life now is that in the context of exposure to significant adversity, so that's the challenge, whether that adversity is psychological, environmental, so coming from outside, or whether it's kind of an internal thing like anxiety or depression or whatever. Resilience is both the capacity of individuals to navigate their way to health-sustaining resources, including opportunities to experience feelings of well-being, and a condition of the individual's family, community, and culture to provide these health resources and experiences in culturally meaningful ways. So this shifts the understanding of resilience from, you know, traits that you have or your personality or, you know, your ability to deal with stress to like, what are the resources available to you? So for you as students, that might be your family, your community, your culture, but it might also be your university, it might also be the workplaces that you're in. What resources are available to you that help you get through challenges? So that is, it's a bit of a shift, that we're not looking just at how people get through based on their kind of emotional strength or their psychological strength, but to look at, you know, what else do they have access to? What else can they draw on in order to get through periods of difficulty? So I'd like you to think of a time when you faced a challenge. And it's probably best that you don't go with like the hardest thing that's ever happened to you in life, because that might be quite tricky to work with. But just go through, like, think about a kind of medium level challenge or even a not too challenging challenge. And then think about what resources you made of. So we could talk about internal resources, which might be like your body, physical resources, you know, I'm healthy, so I was able to do this, or, you know, I'm strong physically, so I was able to do this. There might be psychological resources, you know, certain abilities to think through things in certain ways or to be able to push through or whatever. But also what from the external environment did you draw on? You know, people, places, other kinds of resources, information, that kind of thing. So I'm going to give you a few minutes to just think about a challenge, and then think about what resources you drew on to get through that challenge. And I'll just give you a few minutes for this.
Judith, do you want people to share some of their thoughts, or this is
I
just
was going to give them like another minute,
okay? Cool.
and then we'll move on to that. Yeah. Okay, so let's maybe move on to that. You don't have to tell us what the challenge was unless you want to. But maybe each person could just mention one internal resource and one environmental or external resource that they drew on. Anyone?
I
Yes.
can go.
Mhm.
Thank you, Judith. So I had tried for many years to get into medical school. So if you can put that as a challenge, would be that internally I had to stay very determined and be very perseverant and make sure that, you know, I got all the highest marks I could in my other degree and just was consistent. But
Mhm.
externally, I obviously had to have the support of family and friends and role models that kept me on the path when I did feel a little bit doubtful. So yeah, they were the very big role in keeping me on my path. Definitely family and friends, and people that looked up kept me, you know,
Yeah.
going.
Great, thank you. Someone else willing to share?
Hi, Judith.
Hi.
Hi. I went through I could say a mental health challenge a couple of years ago.
Okay.
It wasn't anything like intense, but I had started noticing that I'm not okay. You know yourself as a person
Yeah.
that, okay,
Yeah.
when I'm normal functioning or whatever normal is to a person, I started seeing that, no, man, there are signs that I may not be okay. I think my first point of like external use of resources was going to see a psychologist, a therapist,
Mhm. Yes.
because I felt like what I was experiencing wasn't normal. And
Mhm.
then another thing that I think kept me going internally was my faith. I
Mhm.
know that if you are someone who is religious, I'm a Christian, so what kept me going was my faith, having community around me, and then prayer, scripture, reading the Bible, and all of that. So, yeah.
Thank you. Thank you for sharing. Is there someone else who's willing to share?
Maybe I'll just share
Thank you.
being part of the conversation.
Mhm.
So let's say not a specific challenge, let's say also just mental health in terms of general well-being, struggling with burnout. And for me, internal resource usually also comes back or very quickly turns to spirituality and reflection that I find very, very useful. And then externally is I find it very hard to actually reach out to people, but I find writing and listening to mentors and exploring resources in terms of writing and teachings incredibly helpful, especially when I'm still struggling to verbalize or to physically reach out to somebody as someone that can be quite guarded.
Okay. Yeah. So it might be difficult to say, ask someone you know for help, but there may be, as you say, kind of teachings that you can kind of turn to that can help guide you through things.
Yes.
Yeah. Anyone else willing to share?
I'll share a little bit.
Mm.
My name's Robin. So I go to NMU in PE.
Yeah.
And we had maybe a month ago, we had 3 weeks of continuous no power, so nothing for 3 weeks. We're
Oh
on
yes,
Earth.
I remember.
And so I think that's maybe just like a slightly more superficial version of where resilience is needed. For example, and I think in this case where we were in the situation where almost everyone didn't have fridges that worked. We were having about 2 to 4 hours a day of power, which can be quite demanding when you're in medical school as well. But with this case, resilience was only possible if you were, as a community and as a group, if you relied on others. If you did it on your own, there was no way that you could maintain that type of resilience for so long. I mean, in terms of food, in terms of devices, the university doesn't really care if your device is charged. If you need to know your work, then take out a textbook and a candle, kind of thing. So in that regard, it was leaning on each other, leaning on your friends, your colleagues, and then internally making a plan and finding that resourcefulness within yourself to find ways. In our case, we'd all have charging banks, or we would sit at the clinics when we were at work and we would charge our devices and charge lamps while you're in the wards, that type of thing. But yeah, so I think moral of the story is just reliance on others isn't necessarily a weakness. In most cases, it's a building block for resilience as well.
Absolutely. It's hard to ask for help sometimes, and I think probably you as medical students are even more like independent and gung-ho and, I mean, certainly for me, when I was diagnosed with cancer, that idea of asking for help, I could do it with my immediate family, but asking other people for help took me a while to get used to. But it makes you super resilient if you are able to go to people and say, I need this thing. And often they're so happy to help you with it, in that kind of situation. Okay, is there anyone else who wants to share?
Hi, Judith. I don't know if I'm audible. Am I audible?
Yes.
Okay. So recently I moved races. I was living in Rochester. It's one of the races of UCT, and I moved to medical residence. And I found it quite challenging because, well, one, I didn't know anyone in this new race, and in medical residence is more of like more final year students, and I'm like a third year, so I was typically the youngest person here.
Okay.
And I guess there's things that I made use of internally, just having self-confidence and believing that, no, I do deserve to be here. And externally, I would say that fortunately enough, there was someone who lives across of me is also a third year, so it's kind of like I kind of like felt like I fit in just because I felt like, oh, okay, she's also there, and also obviously also engaging in house resident events that were taking place that maybe felt more comfortable.
Okay, great. Thank you. That's a nice wide range of things we've talked about there. Yeah, so I'm going to put just a list up that I had put, and we can just run through. People have already talked about spirituality, prayer works for some people, not for everyone. Kind of optimism, the idea that you're going to find some way through this. Self-compassion, which is something I'm going to talk to you much more about in a later webinar. Some kind of ability to deal with stress, and those are things you develop over time. They're not really things you're born with. Some people find journaling really helpful. And, and there are certain kind of mental tricks that you can learn, like seeing obstacles as challenges. Knowing that you've coped with difficulties in the past can also be super helpful. People who haven't faced difficulties are generally, they might be happy, but they're not generally resilient because they haven't had the experience of dealing with difficult things. And then this idea that suffering is a normal part of life, which can just be like, with a power cut, you weren't the only person that was affecting. Like, it was affecting large chunks of Rebecca, and other people were going through the same thing, and other people who were not going through that were going through other things. You know, if you expect to be happy all the time, you're maybe a little bit, maybe a little unrealistic. So just, you know, that acceptance of things, life is not always going to be fantastic. There's going to be times when things are not great, which is just another little, like, kind of way of looking at things. And then some environmental resources. Money and material resources can help with a lot of things, right? And if you don't have access to that, suddenly everything else is like super difficult. Information can be a really useful resource. Emotionally supportive relationships, including counseling. So they can be kind of relationships that are on quite a formal setting, or they can be much more informal, knowing that you can go to people for emotional support. Some of you academically supportive relationships. And those don't necessarily need to be other students. They can just be people who are, you know, supporting you through what it is that you want to achieve. Spiritually supportive relationships, study materials, and role models, mentors, that kind of thing. People who haven't necessarily gone through a particular challenge or something, just being able to think about someone they have seen go through a difficulty can be, that kind of role modeling can be quite useful for people. So yeah, we just need to bear in mind that, you know, with this idea of resilience, that people need to work with kind of both kinds of resources, the internal and the environmental. So for me, when I was diagnosed with cancer, I had a lot of environmental resources. I was not lacking that. So I had good medical aid. I had, you know, really good access to healthcare. I went and stayed with my parents while I had the operation, and through chemo and treatment, you know, so my mom was making me meals, and, you know, so I had all of that stuff. So for me, what I really needed to develop was the individual stuff, because I found that I suddenly discovered at the age of like 44 that I didn't have that. My life had obviously been much too easy before. So it will depend, you know, and I think if people don't have, if they're really lacking environmental resources, you know, if they're very alone, they're really low on material or money resources, just having internal resources is not necessarily going to get you through. I think we have to be a bit realistic about what can be expected of people in certain contexts. So those are just some ideas from me, and you guys have shared some. So the most recent thinking around the idea of resilience is that it's multi-systemic. So, you know, it would include things even like our bodies, so going down to like cellular levels, but also right up to the broader environment. So things like, you know, having access to green spaces can be really important for people. Having safe places to live can be really important for people. But the more interesting aspect of thinking about resilience as multi-systemic is looking at how different systems interact with each other. So for better or worse. So, you know, if you're a cancer patient and your doctor is telling you that you need to have chemo, and your family is telling you that you shouldn't have chemo because, you know, chemo kills you, then the two different systems that are kind of not working so well together, you know, and people might get very torn. So another example might be, you know, I also work at a university. We have a counseling center. There are some issues with it, but, you know, I think it's less accessible to males, not because of the counseling center itself, but because of kind of cultural ideas about, you know, masculinity and men being independent and men not crying and that kind of thing. So, you know, that's a situation in which the resource is structurally available. You know, it's there, it's on campus, it's easy to get to, you walk in, you go and ask for an appointment. But there may be cultural aspects that make it more difficult for some people than others to to access that resource. And I was also thinking about when I went to see the women in East London who were about to have surgery, and one of the women, she'd already been through chemo, so her family had said to her, or a lot of people around her had just kind of said, oh, you know, if you've got cancer, you're going to die, which is not an ideal. So that almost seemed like it was cultural, right? It almost seemed like that was a very wide-based understanding. And it's quite hard to have the internal resources if an external, the message externally is so negative. But obviously things can work well together as well. You know, if the counseling center is available on your university campus and you've got a friend who said to you, you know, I went there, I had a couple of sessions, I found it quite helpful to talk to somebody. And then maybe you go to a lecturer and they're like, why have you been missing classes? And you say, well, I can't really get out of bed. You're like, and they say, have you considered going to the counseling center? And you're getting kind of similar messages. Then that can kind of make things work together. That can make, make things work together. So another example I did a workshop on resilience with a bunch of postgrad Bachelor of Education students. And they're all part-time. So most of them are teachers, and then they have to find the money to pay for this honors program. And they have to find money for traveling to come to the courses and whatever. And it's very hard for them to find funding because they're part-time. And so money is a big thing for them. And so some of them were trying to find other things to do so that they could get the money to do this honors program. But then, you know, the things that you're doing to make money take away your time. And you also need time to be an honors student. So, you know, those lists that we were looking at before work at one level. They're lists of resources. But, you know, we also may need to look at how systems interact. And as I say, for better or worse. And then just another point is that resilience for people might look different at different times. And this actually comes from a paper on family resilience, but it's potentially useful for other situations. And obviously, you know, depending on what the challenge is, and depending on how extreme it is, people might be at different points at different times, you know. So survival might just be like after a cancer diagnosis, that just getting through the surgery, just getting through whatever other treatments, just getting through. And adaptation, kind of getting used to it. Okay, this is how things are. Acceptance is maybe the kind of new normal where you're like, okay, this is how things are. And then there's also the potential to grow stronger, to kind of develop new habits, or, you know, become more self-aware, or develop new internal resources. And then there may be helping others. So some people, and certainly not all people, and not everyone can do this, some people may reach a stage where, because they've been through something, they want to help others. And this is not necessarily a neat, like, people move from level 1 to level 2, and then from level 2 to level 3, but more just to recognize that, you know, someone who's just had something awful happen to them, where they are in terms of dealing with that straight away might be quite different from where they are a month later, or a year later, or 10 years later, just depending on kind of where they are in that process. And some people are just going to be in survival mode all the way, but then I guess that's not a very successful resilience process. But I found this helpful, right? Because it's just different expectations of people at different stages, and different expectations of yourself at different stages, right? So if something happens to you, big or small, the way you deal with it immediately is not necessarily where you're going to be further down the line. Okay, so I have given some examples of challenges that I faced, but maybe you can think from your own experiences or from what you know, or just sort of imagining. And it doesn't have to necessarily be breast cancer, but maybe we can just think a bit about some of the challenges and risks that people who are diagnosed with breast cancer or any other cancer have. So, you know, what are the difficulties for people after some kind of diagnosis? Anyone think of ideas?
Hi, Judith.
Hi.
I think that people with cancer, when they've just been diagnosed, I think they often feel like fearful, I don't know, and that they might die. They don't necessarily always think that possibly there could be something done. They normally go to worst case.
Yes.
Which I think could also then filter down to their families as well. And then they also could become very vulnerable to any opportunity that comes their way that could help them, which is probably not always going to be the best option either. So yeah, very susceptible to people who could take advantage of them as well. And also information as well, if it's not coming from the right places.
Yeah. So information, yes, is a big thing, I think. You know, you can be overwhelmed by information. You can not know what information to look at and what not to look at. Some of the information out there is really scary. I think I looked at too much stuff too soon, perhaps. Yeah. Okay. Anyone want to share anything else?
Hi, Judith. I'll give it a go. I think universally, whether you work in private or in public, I think fear is, like Christina said, is a arching immediate response, either like fear or complete denial, or almost being frozen into this moment of overwhelm and facing this existential crisis that people don't even necessarily know how to put words to. But I find very interesting, so many women almost deflecting the concern away from themselves and from this threat upon their lives to what will happen to my family, what will happen to my children, what will happen, how is this going to impact those around me. Seems to be very prevalent throughout. Then there's fear of the treatment process itself. Once they get to acknowledge that this is something that can actually be treated, is the fear of the treatment. What is this going to do to me? How is this going to change me? And then the overwhelm of choice. Do I actually have a choice here? And how does that look? And what if I choose wrong or listen to the wrong thing? So many layers, I think, that is in a very short span of time, people are expected to find answers to things that's incredibly difficult to deal with. And for our patients in the public sector, I think a great fear of not being able to access the care that they need. They don't know where to go. They don't know where to turn to. There's just this time pressure that's acute and severe.
Yeah. I think there may be issues with time that are kind of different in public and private. Sometimes in private, almost it feels too quick, particularly if people are making decisions about reconstruction. They may not have time to kind of look at all of their options, you know, before they're being asked to kind of go into surgery. And I suspect in the public sector, sometimes things just seem to go on for a very long time.
100%, you nailed it.
Other concerns?
Hi, Judith. It's
Hi.
Lou.
Hi, Lou.
what we often see, or what I experience at least, is that it's before there's a community or there's a helping hand or someone, there's a deep sense of loneliness because of the way that the disease seems to isolate people, because they think others don't understand what they're going through, and how can they? Because that's why I think a lot of these support communities are so important, because it's similar experience. And I think going back into a family where nobody's had it, or that dark, in the dark of the night, sort of deep loneliness of who's actually really understanding what I'm going through is a big thing. We hear it often as well. I felt extremely isolated and lonely, as if nobody really understood what my circumstances were at that point, or still is, or not feeling heard, or not feeling comfortable to speak on it, simply because there's this perception of lack of understanding.
Sure. Anyone else got? Anyone else want to share anything? Maybe later in the, not just a diagnosis, but kind of later, later on.
Judith, just from my experience, some people actually cope fairly well because they are doers. They see themselves or define themselves as fixers and survivors. But the survivors in remission, I find the struggles that they face very interesting. The fear of the cancer returning, living with this new identity as cancer patient, I'm a cancer survivor. What do I do with the changed me after this diagnosis, and how do I deal with the follow-ups, the anxiety of, can this happen again? How it changes relationships, how it changes how people relate to others. I think it's really challenging and often severely underestimated and not well supported.
Yeah. So I think that shifts in relationships, both for better and worse, is very common. People will lose people. People will also gain people. But often it often feels like a period of great loss. You lose a lot of things. A breast, for starters. So kind of stuff around self-image, body image. I think even for much older women, that can be really difficult. It's certainly difficult for women who are diagnosed in like their 30s and 40s. Even if you have, even if there is reconstruction, those are not breasts. Those are like, I call them things to put in a bra, which is not the same thing as having, your natural breasts. And other things like, what chemotherapy and what later drugs do to hormones, right? So people going through early menopause, or having very extreme menopause experiences, how that affects sexual relationships. Obviously, if you are losing one or both breasts, you're losing the body part that is part of your sexuality for most women, and then the hormonal stuff. So there can be those kind of losses as well. One of the things that I found quite difficult to deal with was that I felt like I went from being a person who had a whole personality and was seen as someone who was like, in the university, I'm there with my mind and my skills and my care for students, and I'm known for that. And suddenly I walk into an office and I'm a patient, so all of that other stuff, my whole other person just kind of disappeared. Maybe that was just my personal experience, but taking on that role of patient can be quite difficult as well. All right, does anyone else want to share anything?
I think if I could also just touch on what you said there as well, a big part of it that I think it's easy to forget is how connected having your breasts are to feeling to womanhood. I mean, it's just a fact. And I think a lot of women don't have an issue with it, obviously, but if you've had a mastectomy and you kind of, there's a lot of women that experience this loss of womanhood and this detachment from who they used to be and what made them truly feel like a woman. And I mean, I'm going into like all the extra avenues you can go down with womanhood, but like just having your breasts and no longer having them is a big issue, and like you said, in terms of sexuality, sexual relationships, marriages. I mean, some women it doesn't affect, but some it really does, and it's easy to forget that because you think, oh, the cancer's gone, amazing, but they've also lost a big part of who they were, and something that most women genuinely love about themselves, you know. So I think
absolutely. And you know, things can come in stages. So you know, the first thing is often like just get the cancer out, and then it takes longer to kind of realize that, you know, this is this is permanent. Yeah, I mean, one of my experiences was that, you know, I just kind of got myself through all of the treatments, and then my hair started growing back. I went back to work. My skin started to look a bit more normal. So like a lot of other things were going back to normal. And then I was like, oh, no, the breast's gone, right? Like that's permanent. So you just get so you kind of caught up in the wheel that that things become, that the loss is different at different points. Okay. So let's have a little bit of a think about what kinds of both internal and environmental resources people might need, and also think maybe a bit about what resources are provided by Project Flamingo and how those fit into or might fit into resilience for some of the women or men who are part of the Project Flamingo. So can we think about resources that might be useful to people who've been diagnosed with breast cancer?
Hi, Judith.
Hi.
I think for the external resources might be engaging with other women who have gone through similar paths and come out the other side, or even whichever, you know, everybody's journey is different, but just engaging with those women might help someone who's been diagnosed to know that there is a you know, a road that they can also follow and be okay in a way.
Yeah, I agree. Yeah, and I think that helps with the kind of loneliness and isolation, because there's, you know, there's things you're going through and you might tell members of your family some of it or friends some of it, but only someone who's kind of has been through or is going through is going to like really get it at the same level.
And I also think a lot of people use their faith as well as something to help them get through the process.
Absolutely, yes. So when I went to East London, to the hospital there, the group of women that we spoke to, they prayed together the night before their operations. So that was a combination of both, right? It's like their faith, but also being in a room with other women who were having the same operation, and who were kind of going through a similar thing. It kind of was a double whammy in a good way, I think.
Hi, Judith. So for me, it's just, you know, down to the very, very practical, and especially our patients that we serve, is bare bones, they need access to treatment. So environmental resource to survive this in any way, shape or form is you need to be able to know you can get care. That's the very, very basic very basic of it. But then the layers that gets added onto it is a huge educational piece as well, is translating medical and heavy information in something that is understandable and digestible, and co-opting the patient as a partner in their own healing journey. It's not to resist the urge to, is actually so while they are going through this tremendous challenge, there, you know, is the simultaneous sort of education around health and agency and choice and language, and that almost goes to pointing out something that intuitively they have, but they don't realize the internal resources, be it their faith, their community, support groups, whatever, and teaching things that or putting language to things that we actually take for granted. Yeah, and then the resources provided by Project Flamingo, I would like to think that we try to speak to many of these different layers, helping people to get access to care, helping to translate things into a language that's understandable, and just being there. I think just being a presence rather than a safety net in some way, shape, or form.
Thank you. Are there other resources that people want to mention? Okay, so I'm going to remind you of some of the challenges that we talked about, because maybe that can help us think about resources. So stuff around fear, fear of many things, fear of treatment, fear of death, fear of, what this means for the future, issues around information, so lack of information, too much information, false information, people going into denial, the need to make choices and decisions, and then kind of loneliness and isolation. Those are some of the things people mentioned as challenges. Are there any other resources we can think of that people might find useful?
I mean, if it's available, I think referral to social worker and to formal psychology and counseling services, if that's not available, putting people in contact with formal support groups, helping the patients facilitate conversations with their family, perhaps. Sometimes they're very scared to have those conversations alone. So to help
people, particularly I think if people have children, younger children, helping them figure out what to say, how much to say, can be really helpful.
Yeah. And then very physical things like food, when you go to chemo, and having something to bring to the hospital with you when you don't have much at home, and back to just information that's digestible, understandable, and not patronizing.
Yeah. I mean, there's a range of cancer organizations. I'm not sure that they always connect to each other, or that people are always aware of what is available from different organizations. And it can also be patchy in terms of where they work and where they don't. I mean, I was really surprised that, I went through private care and went to private oncology, and yet there was no kind of like, here's stuff on so Look Good, Feel Better. There's an organization that provides women who are having cancer treatment with cosmetics, and kind of shows them how to use them you know, when you've lost your eyebrows and you've lost most of your eyelashes and your whole face just doesn't look like it used to look. But none of that was kind of advertised, or, you know, they weren't connecting people with some of those resources, and that's in like private healthcare. So I don't know how much is going on in public healthcare where resources that are available are, you know, people are being told about them.
Yeah, it's a definite challenge, and I think it's the availability. And then, unfortunately, I think there's quite a few organizations that focuses more on the private sector, which is sad. But yeah, there is, I think, having a list of resources for patients, and this is where networking comes in. And I think what we try and do is, with Sam, for instance, in East London, is building a network, because not all organizations can do everything. So to strengthen each other's hands and to step into places and cross-refer, and as long as the patient can find the help and support that they need, that's the crux.
Yeah, I mean, that it's knowing what is available is helpful. Not expecting one organization to do everything, but you know, and it's understandable why there are gaps, but it's unfortunate in some ways. Yeah, I mean, in terms of my very brief experience with Project Flamingo, even just putting the women in the same room, I think, is a useful move, you know, so that they are meeting other people who are going through the same thing. Okay, I'm going to stop sharing if I can figure out how to do that. Okay. So, any last comments that anyone wants to share? Anything that they would like to comment on, or yeah?
Well, I would like to really thank you, Judith. I'm sure somebody else will still say something, but this is so useful. The way that you've also linked this with the journey of our breast cancer patients is incredibly helpful, and I think very special for our students, because at this point in their career, the interaction with the patients are very limited and very fragmented, and to sort of get this full picture it's so useful, and hopefully something that they will carry with them as practitioners, because this obviously does not just apply to breast cancer, it's all our patients, right? And then as a medical professional, I think framing resilience not as a individual responsibility, I find unbelievably refreshing and so needed. We are used to functioning in a very high demanding and often toxic environment, and I think a lot has been done to change that. And I think we are part of that change, and this new generation coming up, they are creating a completely different environment. But actually shifting the responsibility from being resilient to just me finding it within me to this is actually a systemic environmental things. Yes, there's things that I can do. Yes, there's things that I should take responsibility for, but that the world around me actually plays so much into how resilient I can be is really empowering, and it's a relief.
Yeah, I mean, and at some points, some things actually have to be changed.
Yeah.
You know? So whether you change them through something like Project Flamingo, or whether you change them through, I don't know, I'm a university lecturer, so like student protests, you know, sometimes you just have to say that, no, we can't carry on like this, that there have to be changes, and stop asking us to kind of fit in around everything. Things actually do need to be changed.
For sure.
Anyone else want to say anything? Okay, if not, the next webinar, we're going to look more actually at the experiences of women, or yeah, probably just be women, who've had breast cancer. Can't think of any men I can find at the moment. So I'm going to ask Lou to send out just like maybe a short like Google form to find out more about what you would like to know. And then I'll probably try and get a few women I know together so that we can kind of share some of our range of experiences with breast cancer.
That
So
would be amazing.
that's the next. That's the next one.
Awesome. Judith, thank you so much. We really, really appreciate your time. We really appreciate your love, your honesty, vulnerability in these conversations. This is why we have them. So thank you so much.
Pleasure. All right.
Thanks, Judith.
Thank you.
Enjoy the rest of your evening, guys.
Thanks,
you.
everyone.
Else, we'll see you soon.
Thank you.
Thank
Bye.
you.
Bye.
Bye.
Bye, everybody.